If anyone has got any questions about the investment into St George Hospital and the emergency department and the mental health department, they may like to come over to the microphones over on the sides of the room. If you do have a question, you are more than welcome to ask it.
Yes, Mr Chairman, my name's Brian Grant and I'm a resident of this area. I didn't get any sense from what Dr Chan was where the important support services for the new emergency department building, and the support services I'm talking about are the interventional radiology, the diagnostic radiology, particularly the location of the CT, scanner, which is important to the radiology department, and also where are the operating theatres located in relation to the new emergency department, and also where is the helipad in relation to the emergency department, given that the St George Hospital is also a major trauma centre.
It's difficult to tell through the fly-through because it is somewhat of a graphic representation, but the radiology department, in terms of our services, will be a satellite service located within the department. It'll have a plain imaging room as well as a CT scan room. We're developing also facilities so that adjacent rooms can later on be used as ultrasound rooms. So we'll be a self-contained radiology unit so that patients won't have to travel for their main imaging from that perspective. Interventional radiology currently will still stay where it is, and that is a little bit of a distance, but there's a relatively small number of patients that go to that, and so we're working through the sort of the routes and the travel issues for any of those patients that would require that. In regards to operating theatres, existing operating theatres obviously are still where they are. What we've worked through is obviously the route to travel, particularly for trauma patients or other general patients who require operations, in terms of travelling there and making sure that the pathway and the elevator services and so forth are able to cope with any of the workload. And in terms of the helipad, actually the new emergency department will be closer than the current emergency department in terms of the helipad. Where we were looking at the view today was literally right underneath where the helipad views, and it's literally across the short divide of the street. You can probably get a glimpse of it on the fly through, because you fly through as you're coming up to the main entrance to the emergency department. The building on the right-hand side of the ED is where the helipad is, which is where the car park is. So all those factors are really important, both in terms of transferring patients once they get into the department to their final destination. So we're looking at all of those things, and the imaging is a really important one, particularly because we are a trauma centre and patients who need imaging from that perspective need it in an urgent fashion.
Thanks, Dr. Trevor Chan. All right, what we'll do is we'll move on to general question and answers. Here, as you said, there's the microphones on either side of the room. Can we please have no more than 2 people per microphone at any one time? So if there's 2 people waiting, and if you want to ask a question, just wait until it's down to 1 person, and then you can hop in, and we'll just alternate between microphones. What we'll ask you to do, this is great. This is where I get to do my Tony Jones impersonation. You just stand up. If you could just state your name, where you're from, and which minister you're addressing the question to. Are you addressing it to Minister Skinner or to Minister Humphreys? So just your name, where you're from, and who you're addressing your question to. So if you'd like to ask a question, please now make your way to a microphone, and we'll get started with our question and answer period. And we certainly have our first question right now.
Thank you. Dr. Klaus Stelter, the President of the St George Division of General Practice. I'd like to direct the question to Minister Skinner. First of all, I'd like to say how grateful the St George community and indeed the St George GPs are for the new ED and the new subacute mental health unit. And certainly, Minister, you can't be across everything, but you probably would be aware that there are other sections of the hospital that are not going to be keep up with what the ED is, especially the intensive care unit. And I'm just wondering whether there has been brought to your attention that there are infrastructure and compliance and building issues in the rest of the hospital.
Yes, thank you very much indeed. Indeed, I am. I actually visited the ICU today and the high dependency unit very briefly, but I've also met with the head of the ICU recently, along with other members of the Clinical Staff Council and the Medical Staff Council. And it is true that there are parts of that hospital, including the ICU, that need upgrading. One of the great challenges is coming to office and finding the extent of the rundown of our hospital system. Over 40% of the hospitals, when I became the minister, were over 50 years old. Many were over 100 years old. And parts that had bits of upgrade, but there were still lots, and there still are lots, that need upgrading. So that's why I was very pleased in the first instance in St George to put up this $39 million, and Dr Chan has explained it well. It is a magnificent building, and I was very pleased when I was joined by the Premier to dig the first sod, that the Chair of the Board, Dr Morris Yema, said to me that this is much better than the former government was going to do. They were going to commit $12 million to upgrade, to renovate the existing ED. That was not to be. Now, what we've done with this new emergency department is put the footings in place that will enable another stage to go up. So up another 7 stories, which will include an ICU, operating suites and also ward space. And that is certainly in the capital asset plan that has been developed by the board, along with other assets designed given priority for this district, including Sutherland, and they are being considered by the ministry and by my office as we develop our forward capital works plan. But I can tell you that both have high priority.
All right, with our questions, if we can keep the questions as brief as you can, so otherwise we'll run out of time. We'll come over to this question over here. Please state your name, where you're from, and who you're addressing the question to.
Paul Holsworth. I'm the chair of the St George Community Advisory Committee. Right, it's addressed to Ms Skinner, please. One, the problem of parking at St George Hospital. It's a nightmare for anybody. The parking, I believe, is something like about $12 for the first hour, and it rapidly builds up. That is one problem. The second problem we'd like looked at is, excuse me, the discharge of all patients by 10 a.m. If that happens, then the beds are available for casualty to move them up. But at the present time, it is not happening. We'd also like a system put in place whereby patients are contacted once they're sent home, so that any problems can be discussed with them rather than at such an anxious time when they come home.
You see the value of having good consumer councils. They're very sensible suggestions, and thank you for them. In relation to the car park, I'm not sure, do we have plans in the future for a car park, Terry? Do you know? They're not in this stage, but it's certainly... Look, it's very interesting. Just about everywhere I go when we're building new hospitals, people say we want the car parking. And it's true, it is a major issue, so I take that on board, and I think it is in the future asset plan. In terms of discharging by 10 a.m, that would be my dream too. Would you like to join my staff? You can help me try to persuade all the clinicians that work for us to come and do their rounds first thing in the morning, so that those patients that need to go home can actually go home by 10 o'clock, because that would be my dream. And then follow up once they've got home. I think we're actually doing more of that. We're particularly doing more of it with a lot of our chronically ill patients, where we have out-of-hospital programs, where we're working very much more closely with divisions of general practice, with individual GPs, also with the Medicare local. And I'm very pleased in this part of the world, the hospitals here have always had a very good relationship with the old divisions of general practice. God, I can remember when I first became the minister, the shadow minister for health, which was in 1995, one of the very first divisions of general practice I ever met was here in St George, and they were very involved then. That's now morphed into, through the Medicare locals, an involvement, and there is cross-representation on boards, and the boards work together very closely. And that's particularly where there's a role for GPs based in the community to have an ongoing relationship with patients who need follow-up once they've been discharged from hospital. They, community nurses and others working in the community health sector. Thank you.
All right, thanks, Minister. We've got a question over here.
My question is to Mrs Skinner. My name is Charles Lancaster. I'm a community nurse from St George.
Yes, Charles.
Mrs Skinner, I'm sure you're aware that patients being discharged from hospital these days are being discharged earlier and earlier in their recovery. It's the community nurse who's actually now facing the brunt of this early discharge, because people are coming home sicker and sicker, and they're requiring much more of our time at home to look after them. Yet our community nursing numbers have certainly not increased. And we don't have the advantage of patient-staff ratios that some of the wards have in the hospitals. So what's happening is we're actually attending to these people, putting the Band-Aid on, but we're not able to actually make sure they're secure and safe in their homes. We don't have the time to follow up with allied health services to make sure that all their care has been attended to at home. So my question is, are you able to guarantee that you can give community nurses the equivalent of patient-staff ratios that some of those nurses in the hospital are getting?
Thank you very much for the question. The reality is, this is all part of the award, Nurses Award, that's currently being discussed with the Ministry of Health. Can I say that there are no ratios in any New South Wales hospitals. They are nursing hours per patient days, and that is the agreement that was reached by the former government, one that we've honoured, of course, and that we will continue to honour. The reason for that is it gives greater flexibility. My predecessor, Carmel Tevitt, who was the Minister in the last government when this was all signed up, said she did not support ratios for the reason that it locked in too rigidly the capacity of nurses to move from one ward to another where there was a higher acuity of patients. So that is exactly my view. The Ministry is negotiating, continuing to negotiate those those award claims with the union. We've already submitted to the Industrial Relations Commission our proposition that the pay increase of 2.5% be met. I believe that's being heard before the Commission on the 12th of this month, which is next week. It's 2.5 with 2.25, which is the superannuation contribution, which is pay in kind, and that is part of the agreement of the Commonwealth Government as well, part of their position as well. But can I say that in terms of community nursing, look, some of the presentations we saw today were from involving community nurses. Can I say I have nothing but the greatest of admiration for the work that our community nurses do through hospital in the home, through providing a whole lot of outreach services. Some of the most stunning nurses I've met have been people who do incontinence nursing, following up geriatric patients and others. They work extremely hard, and I acknowledge and thank you for that. But I believe they provide an excellent quality of care to our patients. And we'll continue to discuss with the hierarchy of the union those claims that they've put in about extending the nursing hours per patient days beyond their current ward locations. Thank you.
All right, just again a reminder, you can keep your questions as short as possible so we can get through as many questions as we possibly can. We have a question here over this side.
Yeah, hello, Rick Taransky, community resident. I'd like to acknowledge the Biddigal people, the traditional owners of the land, and pay my respects to elders past and present. Minister Skinner, let me begin by acknowledging the tremendous work that South Eastern Sydney local health district does in the area of drug and alcohol and mental health clinics in the area. However, the gaping hole that I see in New South Wales Health is the referral times and waiting times from people admitted to hospitals and accessing these services. And that's an area that I feel that needs to be addressed. if a patient presents to a hospital for a noticeable physical injury, such as broken limb or abrasion, I mean, they're not treated by a nurse and sent away for waiting 1 or 2 weeks to come back and have treatment. However, people in our system do have to go and wait for these services, and the emphasis by Minister Humphries on mental health talks about what's the lead into that. And while I understand it's an issue of supply and demand and waiting times in our society, we need to address a way to try and do this, and that's the question there.
Thanks, Rick. Good question. If you're talking about mental health and, say, someone who becomes psychotic, and these are the statistics, 2/3 of anyone that has a psychotic episode is going to be 19 years or under. 3/4 of people who have a psychotic episode are going to be 25 years or under. So a lot of the difficulties that traditionally we've faced with people who become very unwell, and if you've had a psychotic experience, you know what it's like. It's a state of being very unwell. It tells us where we need to put our resources. So you're exactly 100% correct. And whilst we don't have a lot of new money, and I alluded to the Mental Health Commission, it is about recalibrating our resources to the greatest point of need and back to those early stages of not just awareness but intervention. So the only way, well not the only way, but one of the best ways of cutting down those waiting times for people getting into the acute units that we've got plenty of, I've got to say, is by not getting those people into that situation in the first place. And the only way we're going to do that is by having more robust community mental health services. About 8 or 9% of our budget of that $1.4 billion is spent in community mental health services. It needs to be about 30%. Now, it's going to take us a while to get to that stage because we've got an entrenched view that the hospital on the hill is going to provide all things to all people, and that's simply not going to be the case. The other group that we're working, and go back to Headspace, why are we working with the federal government in that area? Because that's targeting that demographic. And the other group that's fundamentally important, and Klaus, thanks, I didn't see that you were here before, is the GP. The current medical system and our rebates is very much geared around the GP, and the GP being the front door into a whole lot of other services. We need to do a lot more work with our GPs in helping them access mental health care plans where they become linked up to psychologists, counsellors and indeed psychiatrists. So sitting in behind groups like Headspace, you will see GPs and psychiatrists. We put out, and I didn't mention it before, we're about to put out an expression of interest to probably 2, maybe 3 local health districts to look at how we reinvest our community mental health teams and that whole I suppose, structure that tends to be based in our hospital system more back out into the community and in effect develop an adult headspace. And that's again targeting that early entry point for people that are starting to become unwell. So there's a whole lot more that we can do, and the continuum of care, if you go from awareness and early entry right up to high acuity, is quite skewed to the acute end. We know we've got to reinvest back at the front end and in that transition component that you talked about. But we've got to work with GPs, we've got to work with everybody along the way, and I've got to say we've got a way to go, and it's one of the reasons why we set up the Mental Health Ministry, to be honest. So you're 100% on the money.
Thanks, Minister. We'll have our final question for this part, and after this we'll go to a quick break. But our final question for this part of this session.
Yes, my name is Brad Rowe, I'm a member of the local community. I live at Mortdale. My question is to Minister Skinner. What are we doing to reduce rates of smoking across this state?
Thank you very much. Very good question. You know, when I first became the Shadow Minister for Health, there had been a move by the government in the 80s and 90s to ban smoking in public buildings, and that was considered quite scandalous when it was first introduced. But that's then been there have been incremental changes over time. It's had total bipartisan support from both Liberal, National and Labor Party in government and opposition. So to the point now where we have probably among the toughest anti-tobacco laws of any state in the country, where we have just introduced but smoking bans in outdoor areas, particularly where families with children gather, so playgrounds, sporting arenas where children and families gather, a certain distance within transport stops, entrances to public buildings, and hospitals and local health districts have been able to introduce bylaws to deal with smoking in the surrounds to public hospitals. So we've gone a long way in the last 20 years. I think we'll continue to move incrementally to make it tougher and tougher. And combined with measures undertaken by the Commonwealth Government, I acknowledge them as well, but there's no doubt that this is a very good investment in public policy in terms of helping to reduce the ill health impacts of the most preventable diseases we have. So I've put a lot of effort into that. We spend a lot of money on campaigns to advise people the dangers of smoking, but then to give them information about how they can help themselves stop. They're called push-pull campaigns. They're quite sophisticated these days, using social media as well as traditional media. And we're also working with others in the area, in the drug and alcohol field, in trying to help address people stopping smoking.